Dear students, we are in the third and the final part of FNMS. So these systems, the microprocessor systems, which can be used as both closed loop as well as open loop, and mostly closed loop we are using the mainly in the implantation whenever we are using the electrodes with implanted electrodes, and mainly whenever we are using for complex tasks such as gate. So gate, because it is a complex task. Why? Because many agonist, antagonist, synergistic, fixator, all these muscle group have to be stimulated using FES or FNMS. So that's why those kind of activities we need a closed loop system. Rather, if you are just strengthening a particular muscle, for example, the deltoid in the upper limb, or the extensors of the wrist extensors, or the quadriceps, or the hamstrings, single alone, if you're doing, we can use a open loop system because it is a simple for used for simple task, or a single symbol, or a single task. So here you can see a person, as I already mentioned, he is a simple machine which has been used, and you can see that two channel, one channel is given for the wrist extensor. So here we are trying to improve the patient's hand function. So to the functional position of the hand is a slight extension of the wrist joint and opening of the fingers with the abduction of the thumb. So here the simple extensor group of the extensor muscles are stimulated along with the stimulation of the deltoid muscle, and then the patient is asked to sit in sitting with proper height. Here the couch, the bed of the patient itself is used as the treatment area, along with the this is actually happening for an inpatient. So here proper functional activities such as putting this cone to this, and then a larger cone involving more opening of the hand is involved. So this is an example of FNMS. We are using FNMS here, the neuromuscular electrical stimulation along with the functional activity, task oriented activity which are giving. So effect for dosage we can divide it into three methods you can use. For example, if the effect of FNF, you are looking for a short term maintaining. For example, where whenever the nerve injuries are like a neuropraxia, that is going to recover, but until the time of recovery the properties of the muscles and the of the area has to be maintained. So that is called a short term effects are contraction, which is going to increase the local blood flow. In long term, we are looking for strengthening. Long term or chronic conditions such as cerebral palsy or stroke, we are going to look for stroke. I'm talking about not hemiparesis, hemiplegic stroke. We are looking for strengthening programs. Eutrophic stimulation, electrical stimulation for strengthening appears to be possible to get an increase in strength with electrical stimulation. So best effects are achieved in NEMIS is combined with active exercise. So active, here the picture we are showing active exercise. So the main benefit of functional neuromuscular stimulation, or FES, functional electrical stimulation, is mainly to improve the voluntary activity. So active exercise along with stimulation. So that means both physiological stimulation and artificial stimulation are combined. That is a major benefit of using FNMS, along with whenever the person is active participant. Already we have understood that somatosensory cortex activation is also happening. So which are the conditions, what are the dosages, we'll go through again. It's a large, many indications are there. Neurological, spinal cord injury. So when I say spinal cord injury, all the partial injury, complete injury, all those cases may come in. Neurostroke, in the other case of neurostroke, is a major cause. Already I have described, you put that also cerebral palsy, multiple sclerosis, or degenerative disease, cerebral multiple sclerosis, and then you have cerebral palsy, which is a pediatric condition as a chronic condition. there also you can apply. And also in neuro, you can use it for brain injuries such as RTA injuries, traumatic brain injuries are also indicated. You can add that also. In cardiovascular, what are the cardiovascular benefits? Beneficial effects of chronic low frequency stimulation of thigh muscles in patients with advanced chronic heart failure. So people with advanced chronic heart failure, there is a history of possible heart failure. Benefits of chronic low frequency stimulation for thigh muscles has been understood. All kinds of musculoskeletal and orthopedic conditions wherever you need muscle strengthening, except that electrotherapy is not a contraindication. In cases where people are having, here also cardiovascular heart, we are talking about if the person has a pacemaker or any kind of metal implant, you cannot apply that in that area. Maybe another area you can apply, but not in the area where the electrodes are placed and the electricity will be, the current will be passing through. So three things we have to think about. One is muscle strengthening, that is, the power, improving the muscle power. Next is a muscle endurance, that is tolerance. So that is a minimum contraction but maximum duration. That is a muscle. And very weak muscles, marked atrophy, such as in the quadriplegic spinal cord injury cases or severe dense hemiplegia and all. So the dosage here is for improving the muscle strength, 30 to 35 hertz. We know that the characteristics are frequency and then you have the pulse duration. So the 30 to 35 hertz of frequency at the rate of what microsecond. We are talking about microsecond, 400 microsecond. So you will give 4 second on, 4 second off. But usually 10 second on, off at least 15 minutes alternative days. But usually 30 minutes per day. So 30 minutes per day, better to give 30 to 35 hertz to, if you want to improve the muscle strength, 30 to 35 hertz at 400 millisecond, that is pulse duration, and then 4 seconds on, rest time of 4 second on, 4 second off. Minimum you should apply for 30 minutes per day, otherwise you are not going to get the effect. Muscle endurance, you reduce the frequency to 20 hertz. Earlier we understood that the effect starts from 12, just about 12 to 15 is the effect of the hertz. So here muscle endurance, to improve that, frequency is same 400 microseconds. Here 20 hertz of frequency, pulse duration of 400 microseconds, 2 second on, 2 second off for muscle endurance. So that means here this one, you can give more time, no, because you understand that the dosage is lesser. So lesser dosage, you can give it for 1 hour in 24 hours. For very weak muscles, very small stimulation, 10 hertz to 15 hertz can be given, 400 microseconds. So the frequency is similar for all the pulse duration. Not the frequency, the pulse duration is similar for all three effects. But frequency is where you are changing the effect. So increasing the muscle strength, 30 to 35 hertz, muscle endurance, 20 hertz, very weak muscle, very atrophied muscle, you cannot go to 30 hertz because the muscle is not going to get activated. So start with the smaller recruitment, improve, and then go to muscle endurance level, then only go to muscle strengthening level. So here also, because the dosage, the frequency is very less, so you can give for 1 hour, 2 seconds on, 2 seconds off. Thank you, dear students. I hope you understood. Any doubt or clarification, please, ask me. I will be very much happy to clear all your doubts. Thank you.